Williams, and I am a family practice physician at POM. I'm also a certified functional medicine physician. We have a lot of people who are intrigued with POM who come by and sort of want to understand more what POM is. And the acronym POM, of course, stands for Personalized Advanced Lifestyle Medicine. So we're the medical part of all of this, but we definitely use the entire facility as part of your medical care. That's why we're excited to be here, because we definitely have a support staff that can assist us in treating patients medically, such as having the salt room, infrared sauna for better detoxification, cryotherapy for inflammation, a full entire gym set up with classes that are not only aerobic based, but also many classes are therapeutic based. So I get a question a lot, what is functional medicine? What's the difference? So I've been practicing medicine for over 20 years, and after around 10 to 15 years into practice, I would get these really complex cases of patients who had these really complex diseases that no other doctors could figure out. And I would listen to their stories, and after multiple visits, really kind of dig into the root cause of their problem, which is what eventually led me to functional medicine. Functional medicine was able to sort of dissect and map out a way for me to more systematically go through the complex medical problem and really focus on root causes and start there. And it gave me a starting point for treatment of complex problems that patients had been suffering with for years, and there were no answers. So many times when patients come to POM to tour or want to learn more about functional medicine, I try to personalize that question of what is functional medicine, because it's such a broad question to what brings you in, what medical problem do you have, and I try to illustrate how and what happened to cause this medical problem. And in doing that, just showing everyone that we're all individuals and we all have different amounts of resilience in life. A traumatic incident that might have affected one person in one way may not affect another person in another, or one illness might be all it takes to put one person into an autoimmune disease or a flare-up, and other people are more resilient to it. We're all made differently, and we should be treated differently. So that's one area of functional medicine. The other big area of functional medicine is also what I call participatory medicine, that we really like to focus on lifestyle being diet and exercise. In fact, in many cases, I'll tell patients, let's start with diet and exercise and push a restart button, meaning your body will change, and then we treat that new body after we clean up diet, after we start to clean up the gut, after we start to exercise. Some patients haven't exercised in years, whether it's because they just don't know what to do, or they just don't like to exercise, or they've been too ill to exercise. So we gradually get your life back, but we emphasize very clearly that you have to participate in your health care. This is something that's really missing in traditional medicine, unfortunately, because they don't have the support staff that we have here to help us navigate that. They also don't have the time with our patients that we will have, and we also don't have the knowledge that we have attained through functional medicine training.